So, good day everyone. My name is Martinico, your nurse for today. So, the procedure that we're going to perform today is the procedure called assisting IV insertion. So, IV therapy requires special equipment such as administration set, IV pole, filter, and regulator to maintain the flow of the fluid. This therapy helps to supply fluids to the clients, and this fluids provides glucose as a main fuel for metabolism, the salt for the maintenance of the electrolyte balance, and some IV fluids also provides water-soluble vitamins, and most importantly, it provides access for the IV medication, especially for the emergency cases. So the first thing that we're going to do is to check the doctor's order. So upon checking the doctor's order, we should note that on what IV solution is to be used. Wash our hands first with soap and water to prevent the transmission of the microorganisms that are present. And then, we're going to prepare all the materials that are needed for us to save time and energy. So these are the materials. So the materials that are needed are the macro set. So this is a macro set. It is a larger tubing which is better for delivering large doses of medication. Then, so this is a macro set. Then a micro set. So a micro set also look like this, but it is used for pediatric patients, and it's also used for small amounts of medications that are needed. So the difference between a macro set and a micro set. So a micro set has a small needle inside, and it is used for small amounts of medication that are needed. Then a solute set. A solute set is also used for pediatric patients, but in this equipment, it is used for more precise and less errors for the nurse. And then the plaster and the starter kit. So a starter kit consists of betadine swab stick, an alcohol swab, a tourniquet, a dressing. And then the next is the IV cannula that has different variations. And we should always take note that the larger the number of the gauge is, the smaller the needle, and vice versa. The next is we should prepare clean gloves. So you should prepare 2 pairs of gloves, in which is one for you and one for the doctor or the IV therapy nurse. The next is prepare a dry cotton balls, and then an alcohol swab, and alcohol, an IV splint, and the fluid solution. Don't forget the waste receptacle and the sharp bottle. Then the next step is to check the information label in the solution bottle to make sure that the correct solution is being prepared, and then we should also check the IV tag or the label where it states in here the name of the hospital, the name of the patient, the room number, the name of the IVF, the medication infused, if none, so write none, the IVF rate, the date today, the time, the name and the signature of the nurse that is assigned, or that is the one who assists the doctor or the IV therapy nurse. So the next thing that we're going to do is to compare the information on the table of solution bottle from the doctor's order. So this is the doctor's order and the solution bottle and then it is for the compatibility of the solutions that are mixed. So okay. And then it is also done to avoid any medical errors. The next is that we're going to proceed to the priming. The first thing we need to do is to wash our hands or sanitize it with alcohol to reduce the transmission of the microorganisms that are present. And then, remove the protective cap of the solution bottle. So this is the protective cap of the solution bottle for the preparation of intravenous infusion. Then, make sure that the solution bottle is completely sealed and check for any leakages. And make sure the solutions are clear. So if not, do not use it. So upon removing, apply amount of pressure, and once removed, make sure not to touch the opening and disinfect it with the use of alcohol swab or in this cotton balls with alcohol. Disinfect. Make sure not to touch it. And then we're going to take out the IV set from the package. So this is the IV set, and then we're going to take out from its package. The first thing is we need to know, or we need to check its expiry date. So this one expires on 2023, so it's good. And then make sure it is completely sealed. So it's still good. So this is the IV set. So which we call this a macro set. And then this has a drip chamber, a spike, and then the bag spike, the tubings, the regulator, which we do open and close it for the IV, and then the injection site and the end port. So after that, we're going to clamp the tubing to reduce the risk of contamination. Then keep the tube right here so that there's no air to go inside the tube, since it could danger the patient once the air is present in the tube. Then the next is to remove the protective cap of the IV set puncture device, and then we're going to insert it to the rubber port of the solution bottle to start priming the solution. So we're now going to remove it. So this is the protective cap of the IV. And then we're going to put it on the rubberized part of the solution. So this is the, let's assume that this is the rubberized part of the solution. So we're going to put it there. And then after that, we're going to invert it and release. And then after that, we're now going to fill in the drip chamber with a solution by pressing lightly on it. So this is the, we're going to press it lightly. So we're going to pull just a little bit. And then after that, hang it to the IV pole, open the tubing, and then fill the tubing completely with solution, purging the air out. So we're going to hang it. So let's assume that it is already hanged. And then the next step is to open the end port. So this is the end port. And then whenever there's no air in the tubing. The next step is to close the end port and then bring the equipment together with the prepared IV solution and the patient's bedside table. It is for us to save time and energy. And that would be all. Thank you. Good morning, ma'am.
Good morning.
My name is Trishan Martinico, your nurse for today. May I know your name and date of birth, please?
My name is Marites Martinico, and I was born on April 25, 1975.
Okay, Ma'am Marites. So here with me is...
I am Dr. Martinico.
Good morning, Doc.
Good morning, and I will be the one to insert your IV fluid. Right here with me is my assistant for this procedure.
Okay, so Ma'am Marites, by the way, I have received an order from the doctor today that we will insert an IV fluid to you because of the fluid loss that you have. Is it okay with you?
Yes, okay.
Okay, that's great. So, first of all, are you left-handed or right-handed?
Right-handed, Mom.
Okay, so is it okay with you that we will going to insert in your left arm?
In my left arm.
Yes?
Okay.
Okay, thank you. So after that, I will put the IV fluids to the IV stand and place the IV stand to where the patient's arm is lying. So after that, make sure that the IV tubings are not dangling on the floor and makes it easier for you to connect the tubings. So the next is to give gloves to the doctor and then get another gloves for the assisting nurse. So after putting our clean gloves on, the doctor will now locate the vein.
Excuse me, ma'am. Can you extend your arms and make a fist like this so that I can scan your veins?
So when the doctor is scanning the vein, the assisting nurse should prepare a tourniquet and give it to the doctor. And if the hand of the patient is cold, we could warm them by using warm packs for 5 to 15 minutes and by rubbing and stroking the hands. So after the doctor has found the vein, so we should disinfect the arm of the patient with alcohol and cotton balls in a circular motion from inner to outer. And then make sure not to touch the clean area. After that, get the IV cannula, and when you see there's a butterfly in it, open it and then remove the cap. Upon removing, you must give this to the doctor with the sharp is in your direction. Be careful not to touch the cannula. We should prepare the sharp container. So once the doctor has located the vein, so we should prepare the tubings and the tape. And then connect the tubings to the cannula and put the tape to where the cannula is to secure it. So after that, take the tourniquet. Take the tourniquet. Make sure that the regulator is open. And then the patient is patent and the flow is dripping so that the IV flow, I don't know if it is already on the side of the vein of the patient. So we should secure the IV cannula by putting additional tape and to adjust the flow rate according to the doctor's order. So if it's 30 drops per minute, so we should adjust it to 30 drops per minute. Put it here in the butterfly. So after the doctor has removed the needle, so we should get the sharp bottle to put it the sharp there and then dispose it. Do not throw it anywhere to avoid the needle prick. After that, put the label. So this is the label. The name of the patient, the room number, the name of IVF, the medication if infused, if it is none, so we should write none, and then the IVF rate, the date today, and the time that is been inserted, and then the name and signature of the nurse that is been assisting the doctor. So this one, we should put it in the IVF bottle right here. And then after that, the nurse must do an aftercare and the documentation. And that would be all. Thank you.